In summary, the mini mental status examination is a very attractive examination because it's brief, it's easily administered, and can be easily scored. Age, education level, and severe psychological factors may influence the mini mental status score. The mini mental status examination assesses cognitive performance at the time of the interview and not only the patient's competence. A lower score is not specific to any cognitive pathology. Who is the target population for the mini mental status score? It's useful to perform in the elderly who appear cognitively intact. Does a low score mean dementia? Is there still a role for mini mental status examination screen in elderly Alzheimer's disease? This screening tool for cognitive impairment is excellent for the elderly population, either in community dwelling, primary care, hospitalized or institutionalized patients, and all populations with memory or cognitive impairments. The mini mental status examination is a diagnostic tool of dementia. It's equivalent to a physical examination. If cognitive impairment was suspected by a low mini mental status examination score less than 24, it's recommended to refer the patients for further neuropsychological testing and specific memory disorder consultation. The association of the mini mental status examination score and dementia. It's generally the first part of the assessment for demented patients. The MMSE is much more sensitive to detect dementia presenting with predominant memory impairment like Alzheimer's disease than those with other memory disorders like frontal degeneration or vascular dementia. Screening for the elderly and the role of the mini mental status examination. In the study done by Benson and others, where they took 86 subjects, 25 were normal elderly controls, 26 had mild cognitive impairment, 10 had mild Alzheimer's disease, and 25 subjects had depression. The mini mental status examination effectively separated those that had Alzheimer's disease from the other three groups, and the mild cognitive impairment group from normal aging. So the mini mental status examination is relatively ineffective in separating normal elderly individuals from those that had depression and individuals with MCI from those that had depression. The severity and follow-up evaluation. The mini mental status examination is a useful tool for dementia follow-up to track cognitive changes that occur with time. In Alzheimer's disease patients, the mini mental status examination score correlates with disability degree and the number of senile plaques and neurofibrillary tangles seen on pathology. The stages of Alzheimer's disease, analysis of consortium to establish a registry of Alzheimer's disease data, where you can see mild, moderate, and severe Alzheimer's disease based on CERAD, and the mini mental status examination was highly correlated. When you look at the mini mental status examination and the staging of the severity of Alzheimer's disease, you also see that MCI, mild, moderate, and severe Alzheimer's disease have lowering scores on the mini mental status examination. In summary, the mini mental status examination is a very good screening tool for cognitive impairment and should be used systematically for elderly subjects. It could be administered in all settings: neurology, geriatric, psychiatric, and family medicine practices. It's a useful tool to follow the evolution of a given patient and has a role in appreciating severity of dementia. In conclusion, dementia prevalence increases with age. Dementia screening should be done for the elderly Saudi population. The mini mental status examination is a practical tool for evaluating cognitive status and screening cognitive impairment. The MMSE is not a diagnostic tool for dementia. The take-home message is the mini mental status examination is equivalent to a physical exam. It should be applied by all healthcare professionals in all settings for the elderly. The MMSE is a screening tool, but not an etiological test for differential diagnosis of dementia. The mini-mental status examination should not replace a complete neuropsychological assessment of cognitive impairment, and age, educational level, and severe psychological factors may influence the mini-mental status score and should be considered in interpreting the examination results. And thank you very much for listening.